Hello, my people. Today is a different day, but today is a beautiful day. I am here to bring you a good news. The much promised abdominal fats video is here right now. That's what I'm here to give you. What is the content? What am I here to give you in terms of abdominal fats? It has different names depending on where you land it. Pot belly? Yes. Beer belly? Yes. Visceral fats? Yes. Abdominal fats? Yes. All these I'm trying to say is known as abdominal fat, or even, did you say what? Abdominal obesity. Yes. Why? Because obesity has certain level of weight compared to your height that will cause you to be categorized as obesity. But now let's think of, why is this a problem? Or is it a problem? It is a problem, because anything obesity, overweight, any time you're having problem that has to do with weight affects a lot of things in your body. Okay. And it's associated with alcohol drinking? Yes, but not entirely alcohol. Meaning that abdominal fat is accumulation of fat in the abdomen, especially in men. Why? Because men has a shape morphologically linked to his genetics that is called apple shaped. In women, they have what is called bear shaped, because in women, fats deposit in their thighs, in their arms, their thighs, and their buttocks. In men, it deposits here in their abdomen. So how does alcohol concern this? Alcohol concerns because, check a bottle of that your alcohol you're drinking, maybe like 750 ml. I know that is about 343 or 347 thereabout. 343 or 347 calories. So with this amount of calories in your body, it's a problem. Yes, because it would cause you some kind of risk of the amount of fat that will be deposited in your body. So we all know that if you have fat, we have to exercise or change our diet to modify how this kind of food that will help us to become healthy. But these fats that accumulate here in the abdomen are the ones that are stored and become unhealthy, because they will now mount pressure on your liver, making it difficult for the liver to synthesize your fat to healthy cholesterol and the liver kind of fat that you need in your body. Because there are cholesterol that is good in your body, that helps you in your hormone and other body functions. But here's the problem. For this fat that is stored here, that gives problem to your liver, poses more risks for different diseases. Yes. Does it mean that women don't have fat in their stomach or their abdomen? They do, but not as much as men would. But there is a measure of fat or abdominal size that is required in men. But before we talk about this, we have to know it in this particular picture or perspective. There is this, to know the risk of diseases that pose, or the factors that pose the risk for some diseases in our body when it is linked to abdominal fat, we will have to know what is called metabolic syndrome. Yes, metabolic syndrome has to do with certain cluster of factors. One is when you are triglycerides, part of your fats, triglycerides is above 150 milligram per dl. That is one. Another one is when your high density cholesterol in men is lower than, when your high density cholesterol in men is lower than 40, and in women is lower than 50. That is two. Another one, abdominal fat. That's where we are now, which is supposed to be number one. When your abdominal fat in men is greater than 40, and in women greater than 35. We're talking about inches. So if it is greater than 40 in men, that means you need a tape. Okay, look at the big belly man in the picture, in the video. Fine, that shows you. So if you measure it like the man and find your own size, that would help you know whether you're at risk of the diseases I'm about to name or not. That's the third one, right? Okay. The fourth one you talk about is your blood pressure. If your blood pressure is about 130/80 millimeter per mercury, that means you are at risk of you have a factor in the metabolic syndrome. And the last one, but not the least amongst these 5, is your blood sugar. If your fasting blood sugar is greater than 100 milligram per dl, that is where the problem is. So now, for somebody who has this abdominal fat, with that measure, most times would have the blood sugar as a problem. Yes. Why? The blood sugar will be a problem because the abdominal fat causes a hindrance for the insulin to transmit your sugar to the cell where it's supposed to be used. So the accumulation of this fat prevents the transmission or the transport of sugar to your cells where the energy is being produced. So what do you do in this situation? That is the question. So do not think that when your belly is big, when your abdomen is big, that you're the big guy that is the biggest money. Do you consider your health of how you can reduce this by physical fitness or your diet? It's not only running. Walk around. It's not only walking around. Do some physical, use stress. Don't stress yourself, but do some physical exercise. But walking is very important. With other exercise, because what you are trying to do when you're doing the exercises is to burn the calories. So those calories that have converted to fat stored in those unwanted places could be burned if you do certain exercise that could help you reduce it. So what are we trying to say? What kind of diseases can this cause? This poses some kind of diseases like your cardiovascular, which is your heart, your brain, cerebrovascular, or it could as well. Cerebrovascular could be stroke or diabetes. Remember, we talked about the blood sugar. We talked about the blood hypertension, that's high blood pressure. We talk about the other factors mentioned in the triglycerides and the HDL. So with any disease that these parameters mentioned could cause, you are at risk of them. And remember, those 5 are metabolic syndrome. So the general risk of this pot belly is that it increases you to the risk of being part of metabolic syndrome, which poses the risk of these 3 diseases which nobody would want to have, to suffer: diabetes, especially type 2, that is what this one will pose you to, stroke, high blood pressure, or any cardiovascular diseases. So with all this, for now, I would want to end it here, but read the article attached to the video, and I'll wait our next video on the different diseases that this has to cause you if you continue. So this is important. As we always talk about exercise, what can you do? The main thing, the major thing you can do in this particular situation, if you already have the pot belly or you are tending towards having a pot belly, is exercise and dieting. Watch your diet and eat diet that will help you, especially fruits and vegetables, to help you do due diligence. Push everything down in your abdomen. Medication is not always suggested, and I will never suggest medication, because this is the first step you take, so that unless the diseases are there, then you have to see your doctor. But for now, that you just realize that pot belly is dangerous and poses you at risk, please, my brother, my sister, start exercise. Watch your diet, and that will go good. But another thing is that it seems this was focused on alcohol. The calories that you take from alcohol could equally be taken from processed foods, burger, all those, and other foods that are processed foods, even some kind of meat you eat, those kind of food that contains calories. So this means that it's important for you, when you are even buying foods that are in packets, check their calorie measures before you even start taking them. So for now, I would stop here until we see again. Thank you very much. Have a great day.